Citizens of the planet, I have the high privilege and the distinct honor of presenting to you the Prime Minister of the Public Health Union.
Thank you. Thank you. Thank you. Thank you. Thank you all. Nice to see you. Thank you. Much appreciated. Thank you. Thank you so much. Thank you. And you too. Yeah. Hey. I see you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thanks. All right. All right. Let's settle in. Let's settle in. Let's get this thing started, okay? Mr. Editor-in-Chief, distinguished panel and guests, my fellow Americans in the United States and throughout the Americas, my fellow global citizens, my fellow public healthicans, my friends, my comrades, my co-conspirators, my allies, all protocol observed. 680 days ago, life on Earth for most of humanity changed in seismic proportions. We collectively experienced another new beginning for which we were neither individually nor collectively truly prepared or positioned to endeavor. But we had no choice. And like our editor-in-chief, I want to take a moment to be mindful of the incredible losses, sacrifices, stresses, horrors, and desperation that so many of our public health family and allies have suffered, succumbed, or survived. And I also want to celebrate the resilience, the triumphs, the perseverance, the humor, the love, and the humanity that we have demonstrated as part of the solution to resisting the apocalyptic nature of the pandemic. While we are not yet ready to exhale, we must be mindful to keep breathing, keep loving, keep hoping, and keep fighting. And so it is this profound moment in which we find ourselves again as we welcome a new year, 2022, with the hopes that this is the year we turn the tide on the global coronavirus pandemic, turn up the heat on the marathon race to end HIV, and other life-threatening or life-altering diseases or conditions such as Alzheimer's, cancer, or mental illness, houselessness, or poverty. Let's shut down the pervasive, slow-moving shadow pandemic of gender-based violence and reinvigorate our fight to preserve and forever protect the rights of women, girls, femmes, and gender-expansive people in all our diversities to our bodily and personal autonomy. With abortion rights in the United States on the verge of being taken away by the U.S. Supreme Court, with a shifting and uneven process for approving and making accessible drugs and devices to the people who need them the most and have the least access, and with economies around the world struggling to revive on the backs of women and essential workers who still need equitable pay and economic opportunity, and because the far right, anti-black racists, fascists, and white supremacists are hell-bent to destroy our democracy in the interest of power and privilege, we are even more energized and motivated to stay in the struggle for the dignity and justice we all deserve. And I'm going to stick to my belief that when women organize, we change things. And when black women organize, we change things for ourselves and for everyone. Just ask President Joe Biden or Senators Ossoff and Warnock from Georgia. They'll tell you the same thing. So what did we learn, at least in this past year, or in this era of COVID-19? We've learned that the health and research literacy are even more critical components to public health than most ever realized, and that public health can and should be engaged in policy, and that politics has no place in public health practice, response, or even policy. It is actually dangerous or life-threatening in many instances, and killing us, literally. We learned that science matters. It is odd to have to say that this is a lesson, but we have seen what can happen to an already weak and scattershot type of health system when science and evidence are challenged based purely on ideology or political leanings or willful ignorance. As much as we've ticked the failures and the lessons, we must also note the successes and the wins. We got a vaccine for COVID-19, many of them. We have seen the FDA's role take on new meaning. We have seen community health centers and community-oriented health programs have a best response to a leaner community health practice. And we've seen them succeed where the big national and global strategies have failed to engage the most vulnerable and those most in need of the basics, just to survive day to day. We have seen neighborhoods turn the tide on the pandemic in their local regions with time, energy, support, money, all to end the pandemic. And we have witnessed some of the greatest advances in health science than ever before. With all that, my good people, my fellow public healthicans, the state of the Public Health Union is not dire. It's not great. It's fair to middling, as my Nana would say. Not all bad, but not nearly good enough to call ourselves safe and on the road to recovery. So, what does this mean for our future? Well, we're at a critical point of opportunity. We need to make some big, crucial pivots in how we see and provide health care for hundreds of millions in the United States, as well as billions upon billions of people suffering globally. We have witnessed and experienced domestically and globally a racial justice reckoning, which I believe must also be followed by a sexual and gender justice reckoning, a climate justice reckoning, and economic justice reckoning, probably others. We have definitely seen a greater global collaboration in science, specifically for COVID-19, new drugs, new treatments, and even new areas of study. The U equals U, undetectable equals untransmittable campaign has gained global traction in the US and countries all over the world. A community initiative that has since been adopted by governments, industry, partners, health departments, communities, and individuals most affected by the HIV epidemic. We can celebrate our many accomplishments while we acknowledge our failures and our long list of more really hard, uncomfortable, and even gut-wrenching work that we have to do in order to truly achieve the best health outcomes for everybody. Public health is and has always been about the future. We learn about and we work to have the solutions that are meant to heal and cure people now while protecting and preventing people in the future. What's the public health future? Innovating justice in public health. And how do we do that? Well, let's start. 1, can we declare and make health a human right? And in the words of the astute Omar Little, we could settle this once and forever? Let's aim higher than disease prevention, treatment, care, and research. Aim for dignity and justice. That's human rights in public health. Public health could be on the right path to diversity, equity, and inclusion with the addition of justice, dignity, and love. And number 2, fully embrace intersectionality. Intersectional lives require intersectional responses. Understand that every person who is living with or in a condition that threatens or diminishes quality of life, or even life itself, is living with a whole lot of other conditions. It is also the route or the route to getting us there. And number 3, public health is the people's health, centering the attention where the center is. Women, girls, Black and African people, people of color, BIPOC people, poor people, transgender, gender-expansive individuals, people who are living with disabilities, young people, people in different geographies, the most vulnerable, needing the most attention, most resources, most representation, most decision-making, most authority, and most power. I quote the intrepid, brilliant, and belated feminist author Bell Hooks, who said, "To be truly visionary, we have to root our imagination in our concrete reality while simultaneously imagining possibilities beyond that reality. There is the possibility of the greatest success in our collective efforts to reach the end of so many of the challenges when we are honest and intentional about ending the racial, gender, sexual, economic, geographic, and environmental disparities in our approach to health for all. The most important of all of our marathons is this one. Public health must lead in the fight for and the achievement of global universal health care for everyone. Did I say global? Yeah. I truly believe that because we are all a part of the same energy, that is the universe in which we live, we are all inextricably linked by our humanity and by our sheer willingness to ensure that our species survives for the unforeseeable future. From South Africa, there's a Zulu term that perfectly sums it all up: Ubuntu. Say it with me. Go ahead, out loud. Ubuntu. It means I am because we are. And as for me, or we, with grace, gratitude, forgiveness, truth, transparency, dignity, and love, Ubuntu, Ubuntu, Ubuntu. And thank you.